Hi viewers, welcome back. In today's video, we are going to discuss about ventricular septal defect. In the last class, we had discussed about the atrial septal defect. In this atrial septal defect, we had discussed that there is a septum or there is a opening between the atrium, that is right atrium and left atrium, there is a opening. So now here it is ventricular septal defect, where the opening is from the right atrium to the right ventricle. So you are able to see there is an abnormal opening between the right atrium and right ventricle. So what is happening here? As there is an abnormal opening, the shunt of blood is taking from the left side to the right side. So what is happening? There is pure blood or the oxygenated blood in the left side of the heart. So now from here the blood is entering into the right side of the heart. So right side of the heart is having deoxygenated blood. From the right side of the heart, the blood is entering to the lungs for purification. So similarly, like your right atrial septal defect, here also ventricular septal defect also there is mixing up of blood, and here again the right ventricle is having pulling of blood. So much of blood is getting collected in the right ventricles, where it is taking time to push the blood into the lungs for purification. Okay, so now what is happening? This right ventricle is getting overloaded and it is becoming heavy, and because of that there is right ventricular hypertrophy. So similarly, like your atrial septal defect. Okay, so now again the signs and symptoms. So here also the signs and symptoms are moreover similar. Like your atrial septal defect only, ventricular septal defects are moreover similar signs and symptoms are present. So that is like symptoms that is related with your lungs, that is your pulmonary hypertension will be present. There will be an increased respiratory rate will be, tachypnea will be present, and there will respiratory distress will be present. The baby will have severe breathing difficulty, okay, and pulmonary hypertension, and because of the right ventricular hypertrophy and because of the right heart failure will take place. Okay, so this is what you have to remember with the signs and symptoms of the ventricular septal defect. So again this confirmation is done by your x-rays, echo and your ECGs. Okay, so similarly, like when you are doing a study, you will be able to see where the mixing of blood is taking place and you can confirm your diagnosis. When we are coming to the management part, so first with your medication, first drug of choice is your digoxin. So digoxin is going to improve the contracting capacity of the heart and it is going to improve the adequate perfusion and the efficiency of the heart. So you give digoxin, and then comes the diuretics. Diuretics, we said like there is a pulmonary overload, and when there is a pulmonary overload, what happens? The child is having breathing difficulty. So to decrease that breathing difficulty and to increase the urination of the child, there will be decreased fluid level in the body. As there will be, when you are giving diuretics, what will be there? There will be increased urinary output, and because of that there will be lot of fluid excreted from the body. So you will have only minimal amount of fluid where you can control your pulmonary edema and the hypertension of the child. So thereby the breathing difficulty of the child will be improved. And then prophylactic antibiotics, as because the right ventricle is getting overloaded with the blood and there is pulling of the blood, so where the perfusion is not taking place adequately, so automatically what will happen? There is more chances for the growth of microorganisms, so the child may go in for infections. So you can give prophylactic antibiotics can be started. And usually we have said like the child will be having difficulty in feeding, the child will have failure to thrive and poor growth because of that. So you have to give increased calorie food to the baby. What you can give? So breast milk only you can give as an NG2 feeding. It is like increased calories with supplementations you can provide to the child. And then surgical closure. So medical management we have seen, and then surgical management is like you have to close the shunt. So last ASD we have seen closure with an occluder. So here also you can either close it with the stitches, or otherwise you can use patches also to close. Okay, sometimes when you are going for catheterization procedure for the occlusion, you can go as your catheterization procedure, you can go and occlude the shunt. Okay, so this is with the management. So when we are coming to ventricular septal defect, the shunt is from the left side to the right side shunt, where the oxygenated blood is mixing with deoxygenated blood, and the right ventricles are getting overloaded, and it is going to the right like lungs for purification. So as because the lungs are getting overloaded with the blood, what is happening, there will be severe breathing difficulty. The child will have symptoms related with the lungs. Okay, there will be breathing difficulty, tachypnea, murmurs, failure to thrive, all these things will be present. That can be diagnosed with your confirmatory x-rays, echoes and ECGs. So that will help you in diagnosis or confirmation of the diagnosis. And then coming to the management, you are going to start with digoxin to improve the contractibility of the heart and to increase the efficiency of the heart functioning. And then we have diuretics to decrease the edema, pulmonary edema you are going to decrease. And then we are going to give prophylactic antibiotic, as you are expecting for infections to happen. So for that you are going to give prophylactic antibiotics, and then we are going to start with more caloric foods for the baby. So in case if it is a breastfed baby, you are going to start EBM with NG tube. Okay, so that's what with your medical management. And when we are coming to surgical management, either you can close the sutures with stitches or otherwise with patches. Sometimes when you are going for the transcatheter management, you can go in with septal occluders. Okay, so this is what with your ventricular septal defect. Hope you understood the class. In case if you have any doubts, kindly give your comments in the comment box. See you in the next class. Till then, take care. Bye.